Hi, this is Dr. Terry McCann at West County Plastic Surgeons of Washington University in St. Louis, and I'd like to address a question that comes up pretty commonly in our practice, which is, when should I be getting a mammogram if I'm considering breast augmentation, breast lift, or breast reduction surgery? Typically, for women in the United States who do not have a close family member with a history of breast cancer, we recommend getting mammograms annually starting when you're 40. Now, if you don't have any family history of breast cancer, you're seeking breast surgery, we actually recommend getting a mammogram if you're 35 years old or older. So for example, let's say that a 36-year-old woman comes to the office and she's looking for a breast augmentation or a breast lift. There's no family history. We will get a mammogram for that patient since she's 35 years old or older. And then, assuming that's clear, she's had her surgery, we would continue on with mammograms starting when she is 40 years of age. Now, that changes if they have a close relative, such as a mother or sister, with a history of breast cancer. So what's recommended there is if you have a relative who, for example, developed breast cancer when they were 35, then we recommend that you start getting your mammograms 10 years prior to the age that your relative was diagnosed. So if your relative was diagnosed when they were 35, you would start getting mammograms when you were 25. So if you show up in the office, you have a relative who had breast cancer when they were 35, and let's say you're 31 years old, then at that point, yeah, we would recommend that you get a mammogram before starting with breast reduction, breast lift, or breast augmentation surgery. And this is consistent also with the American Cancer Association recommendations as well. So again, starting to get mammograms 10 years before your young relative's diagnosis. Otherwise, start getting mammograms if you're not seeking any sort of breast surgery at 40 years of age, and then annually thereafter. Thank you very much.